98.5 Super FM this morning. I am your host, Fauhn Minvielle, health educator with the Bureau of Health Education. As always, it's a pleasure to be here on a Monday morning, and I'm very happy, as usual, to have our frequent listeners, those of you who tune in all the time to listen to us and to participate. Last week we had quite a few questions, and that really helped to engage our guests and to get answers out to others who may have had similar questions and probably did not post those questions. To our new listeners, welcome to Casualty 911. It's our second program of the year. And this year, we look forward to having very informative shows, very exciting, and we hope that all of the information that will be shared will help you to make changes towards a healthier lifestyle, because this program is all about engaging you, encouraging you, providing you with information that can help you to have a healthier lifestyle, whether it has to do with diet, exercise, screening, whatever. We are in January, and as some of you may be aware, in almost every month, there are various observances as it relates to health. This month of January is Cervical Cancer Awareness Month. And because it is Cervical Cancer Awareness Month, we are trying to bring out some information about cervical cancer, the services available, and so on. Joining me today to share that information, to engage you, is Nurse Deterville. I will allow her to make a little introduction to tell us a little bit about herself professionally and maybe a little bit personally. I know sometimes people have those, little personal bits and pieces that makes them seem so much more approachable and engaging and so on. So I'm sure Nurse will be very happy to tell you a little bit about herself. And when we delve into the topic, we will be speaking about what cervical cancer really is, what are the risk factors, what are the symptoms, when can we expect to see symptoms, what can be done to reduce the risk or to prevent cervical cancer, what is the process of screening like, and what is the follow up to that screening? Because when you screen, sometimes you have a very clear outcome where everything is good, but sometimes there may be some issues that need further investigation. So we'll be looking at all of that on today's program. So it is my pleasure to welcome you, Nurse. Like I said last week, I'm learning a little bit of the technical part of it too, so please excuse me if you hear a little noise. So, Nurse, welcome to Casualty 911. We have with us Yasmina Deterville. And Nurse, please share a little bit, tell us a little about yourself before we delve into the topic of cervical cancer.
Okay, well, thank you so much for having me. Am I being heard clearly?
Yes, I can hear you clearly.
Okay, that's great. Okay, like I'm a family nurse practitioner and I'm currently based in Region 3. I actually work in Dennery, but I am attached to cancer screening. So I may have been seen in previous, I was interviewed a few months ago just to promote this very same topic, which is very concerning to the women's health. So, and again, we recently launched the new method of cancer screening. So we had some good discussions about it. And I am I really care about women's health because we know that the prevalence in women's health is, there's cardiac disease, there is cancer of the breast, cancer of the cervix. And when you think about these kind of conditions, there are basic measures put in place to basically help detect these abnormalities early so that women can get timely intervention. So I love women's health. It's my priority area of care. And being a nurse practitioner, maybe persons may not know, but we do have nurse practitioners in St. Lucia. We able to prescribe common and treat common conditions. We refer clients to advanced practitioner consultants, and we do work with our colleagues, our general physicians. So it's a pleasure being here. And so let's see how we go from here. I hope that was enough personal information. I like cats. I don't know if anybody can appeal to that. I love them. So I don't know if any cat lovers out there, you could, come stream in
So
and
I can definitely see that the two of us, I'm not a cat lover.
oh, sorry about that.
We don't have that in common for sure.
Oh boy.
Well,
Okay.
thank you for that introduction, Nurse. I understand why you were selected to join us. Okay,
Oh, you're
so
welcome.
let us start off by talking about, and you mentioned it. You did say cervical cancer is about women's health. So for anybody out there who may have not been aware, cervical cancer
Mm-hmm.
is a women's health issue and not a men's health issue simply
No, it's
because
not.
men do not have a cervix. So let us
Exactly.
start off by talking a little bit about the cervix and
Mm-hmm.
why it is only women who have to deal with that issue of cervical cancer. What is the cervix? Where is it? And so
Mm-hmm.
on. And then we can speak a little bit about,
Mm-hmm.
why we call the condition cervical cancer. Does it just
Mm-hmm.
appear out of nowhere? Are there risk
Mm-hmm.
factors? And so on.
Okay, yeah, sure, no problem. So, the cervix, you'd be surprised to realize to know that a lot of women do not really know that they have a cervix. They feel obviously there's just can we use certain words in this broadcast? Can we use okay?
As long as they're anatomically correct. So it's a body part, yes.
Yes, okay. So we know there's obviously the external part of the women's, the external genitalia, and we go in where inside is actually the vagina of the woman. People tend to think it's just the external part of it. That's just the vagina, but it's just a component of it. And then after the vagina is like a small vault, right? And then you would meet the cervix. In other words, the cervix, as this is the neck of the womb. If you look at how could I yeah, a donut. Let's picture a donut in our minds, and you see that the donut has a little opening. If women were to remember when the nurse would be checking you right to have your baby, and they would say, you're 2 centimeters, you're 1 centimeter, you're fully you're ready. It says that this is the passageway, this is the little organ that actually stretches itself out from being as thick as similar to a donut, and it actually thins itself out to allow the passage of the baby. So the cervix is a very much important part of the woman's anatomy, the reproductive system of the female, and it's an area that is heavily infected. We're moving on to the HPV virus. I'm sorry, I don't have a picture of the cervix to show because people might just picture the donut. But usually, when my clients come to me, I'm quick to pull up a picture and to show them, this is what it looks like. And they say, oh, okay, does that make sense? That is true. If it's like a little ball inside of me, yeah, that's why the smooth edges of the donut. Okay. So why the cervix? HPV, cancer of the cervix is directly related to exposure, especially a recurrent exposure of the HPV virus. For those who do not know, the human papilloma virus, and there are multiple strands of that virus. Most of us, those who have been sexually active, we most likely in our life, and we've already been exposed to this virus. It's just that some would phase out, our body, especially for the youthful ones, our body will actually help get rid of it, will phase out. But there are really high risk strands that when your body is exposed to it, they're a bit of a troublesome virus, and they remain there, particularly if you get reinfected over and over again. So this virus gets placed or attached, or your cervix is exposed to the virus, and then changes in the cells of your cervix, it takes place in there. Now, cancer of the cervix, it goes in different stages. For ladies who do their pap smears, you notice the nurse would say, okay, it's a little bit of inflammation. It doesn't mean that there is any cancer of the cervix, but it's also always concerned when there is repeated inflammation. If they say you did your pap smear or inflammation, okay, all right. So they would advise you accordingly. But the following year inflammation, the following year again, so it means that there is some level of exposure that needs to be a little bit of investigated. Sorry, the reason and risk factors for um, cancer of the cervix is number one, like we said, the HPV virus, and it's obviously related to sexual intercourse. If you have more than one sexual partner, you increase your risk of getting exposed to the high risk strands of HPV, right? So your body doesn't just stay there and just create HPV. Now, the third risk I could think of is obviously a family history of cancer, and against lifestyle. You see, lifestyle choices is really one of the dominating factors. With family race, you can't really do anything about it. You just care for yourself as you should. Whether it's smoking, whether smoking aggravates these other health conditions, you would say whether it's obesity, you try to maintain your weight. But when it comes to lifestyle choices, really you're the one responsible for what you put in your body, your sexual practices, and all of these things. So these are and that and yeah. So if your partner is unfaithful, there's a high risk chance that you could be exposed to other. And if you have another partner, and you do, especially if you don't use barrier methods, this you put yourself at risk for developing HP for moving transitioning to the HPV virus into the early stages of cancer of the cervix.
Okay, so when
Okay.
you say barrier methods in this, could you break that down a little?
Oh, I'm sorry. It is true. Yes, barrier methods. Most of us do not know it, but barrier methods are actually simple as a condom.
Okay.
Or one of the unpopular ones is the female condom. Most ladies they tend to shy away from it. It doesn't look
It's
pleasing
not
to
as
the eye.
used.
Exactly, it's true, but it works the same as male condom. Like, it doesn't take away any sexual pleasure. So it's available for the ladies who want to try it. So this is what is classified or put into the bracket of barrier methods.
Okay, thank you.
Yeah.
So we have spoken a little bit about risk factors, and among the risk factors, the key one that you mentioned is HPV, the human papilloma virus.
Yes.
For parents who have children at the primary schools and the secondary schools, some of them would have been informed about a vaccine. So, in
Mm-hmm.
terms of risk reduction,
Mm-hmm.
there is what we call the HPV vaccine that is given to students. So, if you
Yeah.
could speak a little bit about that
No
and any
problem.
other in terms of risk reduction, you've already mentioned the barrier methods, the condoms, the female and the male condoms. So
Mm-hmm.
let's talk a little bit about the vaccine. Who gets it? Who is it administered to? Who is
Mm-hmm.
it available to? Is it only available, as I mentioned, to students, or is it available to others?
Okay, all right. Thanks for that. Well, the HPV vaccine, it was introduced in 2019, right? So I remember in having discussions with parents, they were very skeptical because it's a new vaccine, although it had been basically used universally worldwide for a number of years. So, and I could appreciate the approach that our government takes in watching carefully, see what the data comes back, what does it speak to. And so it was introduced in 2019, and parents were very, very concerned. But we, let's say, would vaccinate the grade 6 school, and you would get a class of maybe 24, but maybe about 3 5 out of that 24 students, the parents would say no. But as the years go on, we're seeing like 100% vaccination. Initially we were doing like two vaccinations, 6 months in between, one vaccine, perhaps in November, or October, and then the 6 months later we would be looking at maybe around May. But recent, if research suggests that fully vaccinated, the child is fully vaccinated with just one dose. So presently, we give only one dose to the grade 6 students. And that's the, I still use the word common entrance. Sorry, I can't. Those who go up for common entrance, and so it's we were presently, the ministry is looking at exploring at the older population, where we could extend it to the older age group, but it can be given up to where it's just marketable right now. It's just available for the grade 6 students in the primary care setting. That's your wellness centers.
Okay. So you mentioned that older age groups could
Mhm.
receive, maybe not yet available to older age groups here,
Yes.
but what would be the age, the maximum age at which they could receive that HPV vaccine? Are you aware?
I believe the discussion was possibly in the early 20s maximum. I don't want to give out, but I know that's the discussions we had previously. I'm not privy to any new updated information. But a young adult can receive that vaccine, and but it's not yet available to our wider public as yet. But it's been looked at very closely right now.
So
Yes.
just to maybe move a little bit away from cervical cancer, in the sense that you mentioned that the
Hmm.
vaccine is administered to grade 6 students, which would include boys and girls. So I think it's
Yes, boys and girls.
an opportune moment at least to
Hmm.
explain why both
Hmm.
boys and girls receive the
Hmm.
HPV vaccine.
Yeah, it's not to have a vaccine, especially the HPV vaccine, is not like a female thing. Like we know, it's clearly directed at sexual intercourse. 10 years from now, these children would hopefully be sexually active. So we know that the carriers, the HPV can be easily carried with the men, especially if they're perhaps not uncircumcised. That's why we still encourage circumcision for those who opt for it. But women, we don't want the man to be a healthy carrier of the HPV vaccine. And even if the lady does happen to be a carrier, but it prevents obviously from having to be a carrier, I should say. So women and men, young boys and young girls, they both benefit from the HPV vaccine. They both do. So it's not a female thing as people would think back in the past.
Oh, thank you.
Hmm.
You also mentioned circumcised versus uncircumcised. Just explain. Nurse, I like my guests to break it down,
I'm
because
sorry, I'm using all this. So
that's not
circumcision,
a problem, but just be aware that I will be asking you to break down
no
things.
problem, to my best of my ability. So circumcision is basically the removal. All males are born with the skin, the extra skin. I'm going to put it as that, the extra skin on the penis. So circumcision is it's actually a very, very old method that was used years, thousands of years ago, but it's proven to cause the man to be healthier in when it comes to his sexual health. Um, and also the skin is removed. It's cut by a physician, and it heals quite quickly. And they would put some stitches on the skin so it can heal very good. So it's a common practice. We see that people still do it, and older I've even encountered older men who wish to get the extras, the foreskin of their penis, because it can be a little bit too much. or it can even cause them to basically it affects their hygiene. They feel like they're not clean enough. Yeah.
So it may not necessarily be as common in St. Lucia as elsewhere, but
I don't have the statistics for it, but I know that it is a common request of parents, and they go to the pediatrician or the general surgeon. And I've seen older men have it too.
okay. Thank you, Nurse. Okay, so
Okay.
the other aspect of risk reduction that you mentioned earlier, and I think we need to go a little more in depth with, is screening. So you
Mm-hmm.
mentioned the pap smear. We'll talk
Mm-hmm.
about what the pap smear is, how
Yeah.
often we need to have a pap smear done, who
Mm-hmm.
should be having a pap smear, what at what age should they start? Because
Mm-hmm.
there are young people who and there's that really that gap, there are young people at
Mm-hmm.
school, your parents are responsible for all your medical interventions. They decide when you need to go and get stuff done, but then as you get older and you need to take responsibility for your own health matters, you may not really be aware of when you should start. When should I have my first pap smear? How often
Mm-hmm.
should I have it done? There are people who have certain conditions. For example, very quite frequently I've encountered people who have had hysterectomies, had the womb removed,
Yes.
and
Yes.
they talk about whether they should have a pap smear or not. So let us talk a little bit about those issues as it relates to screening.
Okay, sure. So before it was the criteria for screening, how would you qualify to get a pap smear done? I should also make mention that whenever somebody comes to the health center, the breast examination, a lady comes to the health center, the breast examination is also done. Okay, it's part of the package, I should say. All right, it's part of cancer screening. So before the thought was you should be 18 years and older because we know about the legalities of the age, sexual consent and adulthood. But it is advised that once someone becomes sexually active, you do qualify to have a pap smear done. So we know I understand the dilemma with the minors who are sexually active and they do keep it a little secret, and then you only find out when they get pregnant. But we want to ensure that this care is given to everyone that is sexually active. So if we have young girls out there that are listening to this program, you may be a little bit private if your sexuality and so on. But once you are having sex, please, you could, if you're able to speak to perhaps an adult that you can maybe trust, because you need to get the care, and we're open to you coming to the health center, and we can give whatever care that is due for you. Don't rob yourself from that care. Okay, yeah,
Yeah,
so we
by an adult nurse.
yeah, it is still because they are still in an age group where they need to be escorted to medical clinic. Like 16 years and under, they need to they need to be accompanied by an adult or older individual. So I would not. I'm not sure what is in the discussion concerning that. It has always been a sore point for even us, the clinicians, but this is what is instituted for now. Okay.
So
So.
being
Mhm.
sexually active, okay, we've dealt with that. So there are some young people, for example, who have reached the age of 18, 19, 20, 21, and are not sexually active. Should they have a pap smear? Or so
No,
should they wait until they become sexually active?
they should wait until they become sexually active because, like what was said earlier on, HPV, the cancer screening is really directed to those who are sexually active. If you want to have your breast examined, that can be done. But if you are not sexually active or if you've never been sexually active, there's really no need to have a pap smear done. A pap smear done. Based on all the criteria, it doesn't indicate any person to come and have a pap smear if you have never been exposed to sex, I should say. Okay. So we encourage right now. I hope I'm not going ahead of myself because I spoke about the new the method that we use right now. Where should I go into it right now, just so and I can break down the
I would like you to deal with the frequency before you
okay.
go into that. So,
So
for
the first
example, how often should we be screened, and,
uh-huh.
and talk about the issues with people who have had their womb removed or have had a
Okay,
hysterectomy?
thank you. All right. So, based on the criteria, because of our new intervention, we're looking at women from 21 to 25 years who will get a cytology testing done, cytology and also HPV. So every time, if you're based in that age group, 21 to 25, it's we're looking at HPV testing, right? So every time you come to the health center, when we take the sample, we'll also request that we check that you have whether there's HPV present or not. And automatically, then we would have what they call the cytology testing. Cytology is to check to see if there's any abnormal cells growing that are there besides HPV virus. Okay, so that's what it really stems to the new testing. I say you'll go into it later, but the ladies who've had if there is a HPV, if there's a positive HPV, then you'll have to get referred to the site of the clinic where we do colposcopies, where it's an advanced samples may be taken, some new procedure may be done for you to get rid of this HPV virus. Okay, and also if the HPV is negative, then it's advised that you get screened 5 years later. Now, some ladies, they're not satisfied, they don't feel comfortable with the 5 years. Okay, so it's at your discretion. This is what the advisement is. But if you choose to get tested like the following year, we have no issue with that. We have no issue with that. But the
There's
advisement is
quite a few women who annually have a pap smear. So they
yes.
come in and they get their breast exam in the clinical breast exam and their pap smear every year. So
Mm-hmm.
that no longer really required with this new method.
No, not necessarily. No, it's not based on the recommendation. However, like I just said, they're not entirely sure because they know their sexual practices. They know whether they have a new partner in their life. They know whether there is some other questionable behavior, sexual. So they want to be sure that they're okay. So they come. I recently had a client that had a pap smear done February, February of last year, 2024, and the results did not come up with any HPV virus. However, she said, "Nurse, I feel like something is not right. I am not even sure if I could really. My partner, he says no, that he's seen nobody else, but I feel like he is seeing somebody else." So, come January, just a few weeks ago, earlier in January, I had to do the Pap smear for. I did the Pap smear for her. So it validates what she's thinking, it validates what she's feeling, and it reassures her that everything is really okay with her. Yeah.
So basically, generally, it would be advised that if you have a clear test, that you repeat after 5 years. But if you feel
Yes.
the need to have it done more frequently, you will not be refused. So if you come
No.
in every year, nobody will refuse you and say, no, you cannot have it because you just had it last year.
No, we don't refuse clients for sure. But if we see you like okay, let's say that you're in a steady relationship, it's one partner, there's no questionable behavior, but then it's like we need to know why is it okay? Like, is there any other concern, underlying concern that you might have, but you're not speaking to, and say, oh, my mother died from cancer. I just want to make sure, and that would intervene and say, you know what, this client of ours would require a little bit of additional assistance.
So there are a lot of issues related to lifestyle that have to be taken into consideration.
It's true. It's true. And we have to listen the concerns and see how we can assist in addressing most of the concerns because we do have measures put in place for additional counseling and so on. So you spoke about the hysterectomy. So ladies, when we think about hysterectomies, why did you have the womb or the uterus removed? Was there cancer of the cervix, cancer of the uterus, and or what is why is the reason why you had the hysterectomy? And if it was like, let's say, uterine fibroids, and the cervix was left, yes, you can still have your cancer screening done. You can still have your the sample can still be taken from the cervix, and you can still have it done. If it's negative for any HPV, we go back to the criteria. 5 years later, you can return to have another pap smear done. However, if it was cancer related and the cervix was removed, we need to I would your OBGYN your would consult you according to how, because I've met clients who come, they have to check to see if any cancer cells have been left over. And again, usually the cervix is removed, so there is no need for a pap smear to be done because there's no cervix. Like we said earlier on, the qualifying factor is a cervix. So
cervix.
if there's no cervix, there's no pap smear that can be done, and that one client will follow up through with with a gynecologist. And I have seen physicians do high vaginal swabs that can be done, where sample just the swabbing that will be done inside the vagina. But remember, there is no cervix in this matter. So
Yeah.
yeah.
So now, Nurse, we can talk a little bit about the new method. How is it different from the old method? Um is the procedure, because in terms of having, I think many women will be happy to hear that they can wait 5 years, because one of the barriers for some women is that
Mhm.
they find it so uncomfortable.
It's true. It's true. And I have frequent conversations with them about that. And sometimes their friends get them scared, and then when they come, they get the procedure, and they say, hey, but nurse, your hands were gentle, I feel good that I had it done. So the new method, and I just want to encourage others, do not let somebody else's experience be yours. Everybody's experience is really different. Perhaps this one person had some bad infection inside there, and that caused it to be very, very, very uncomfortable. Because if there is an infection inside by your cervix, especially it's been there for a while, it's going to be painful, because it's just because you've been you have no idea that you needed treatment. So the new procedure, the new method, I'm always excited to talk about it. I had mine done last year around my birthday time, so I rewarded myself in getting the my pap smear done, because I need to lead by example. And I felt good about it. So as we know, although when you speak that, the ladies think, oh, the speculum, the metal object, the speculum is no longer going to be used. No, we still need to use the speculum, because how else would we be able to keep the vagina open and be able to see the cervix, and see? Because I always tell the ladies, when we go inside, it's like a little like this is the forest. It's just that you have a different atmosphere. It's something different. What you see on the outside is not what you're going to get on the inside. Yes. So hold on. Sorry, I have an interview. Sorry about this. Yes. The where was I? I lost.
The
So the
speculum
pap
different.
the
The
speculum
speculum
is
makes
still
sense.
used. The speculum is still used, and so it's open. It's used to open up the to see the cervix. We see, make sure that it looks it's healthy looking, and we I am guilty. I should have taken the brush. We have a tool instead of wood spatula that most of us are acquainted to. There's a small brush. It's very flexible. It's used to just collect the sample in the not directly in the cervix, but like let's go back to the little donut. Remember the little donut? So
You're
instead of
breaking
just
up a little bit.
it's no longer on the side, but the glass is fixed.
You're breaking up a
Can
little
you hear
bit.
me? It's disconnected
What's
for
happening?
okay, it's back on. Yeah.
Okay.
So it okay. Are we better?
Yes.
Are we better?
Yes, we are.
Okay, good. Okay,
You go
good.
ahead.
So yes, thank you. So this little broom, I would say, is actually placed inside a liquid base. It's actually alcohol, and it is labeled with your name, the date that it was taken, and the health center or the health institution that you're coming from, and it's placed inside there, and it's nicely sealed, and afterwards, it is placed in a secure bag. Your lab request form is written up, and it is sent to the lab basically almost immediately. So the alcohol base is it preserves the cells, and it causes the sensitivity to be it causes a more accuracy with the results. That's why when it's processed, we're able to see the HPV virus and also any abnormal cells, which is labeled as cytology. So we're looking at any other abnormal cells that has to be looked out for. And so far, I should say that we've seen a lot of HPV positive cases that have been present in our female population. Yeah. So yes, and it's within the high risk strains. So
Oh,
these ladies are then referred to our specialty clinics. We I believe V40 is going to be opened up pretty soon. I'm
yes.
not sure of the date.
Colonoscopy clinic should be on every second Wednesday of the month.
Okay,
On
excellent.
Monday, we open today, and then thereafter,
Um,
second
and then we
Wednesday.
have ancillary and also Grozzily. So these are our free areas in the community where the procedure advanced. Remember, you will see the community gynecologist, and then whatever procedure he sees best for whatever that was presented in your document, then you could go ahead with that. I don't want to say that will be done because it's not for me to see, but rather for the OBGYN and the gynecologist.
To make that
Okay. So,
determination.
but we have been seeing many cases, and the ladies, can you imagine that some of them that they haven't had pap smears done for almost maybe 5 to 7 years, and finding
I
out that
get
all
on.
along there was something growing in.
I would not be
Yeah.
at all surprised because as a health
Mhm.
educator, I encounter people out in the community, and sometimes you speak to people and you ask, "When was your last pap smear?" And they associate it to when they had their last child. And if you ask how old is that child, they tell you 15, 20. So there are
Yeah,
people out there
it's
who have
true.
not
It's
had
true.
pap
Yeah.
smear for a very long time.
Mm-hmm. 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 Yeah.
And I
But
and I
we're happy because go, mm-hmm.
Okay,
Go ahead.
I was going to say that there are many barriers, and one of them
Mm-hmm.
happens to be that expectation of pain, and some
Yeah.
people, I think, maybe health wise we just don't take things so seriously until we actually see some signs or symptoms,
Yeah.
which in the case
Mm-hmm.
of
Mm-hmm.
cervical cancer, generally early on there are not that many signs or symptoms to alert
Mm-hmm.
you in the
It
early
is true.
stages.
It's quite
So,
true. It's quite true. That's
yeah,
why I usually encourage the ladies, this is the person's experience. Like I said, this lady may have had an infection that she did not even tell you about because it's her business. But perhaps the screening is already labeled as already painful, but it normally is not. Yes, you will feel like a stretching. Yes, you will feel little touching inside, but bear that in mind that I'm doing this because I want to make sure that I am okay. And if there happens to be anything, I will be positive about it because there are things put in place, measures in place where I can get treated and I will be fine. Because one of the things that our community pediatrician spoke about, I mean, he was very passionate about it. He said, what you have a procedure that is done basically free for you, pay nothing. Okay, ladies, you pay nothing for this procedure. Yes, it's a little uncomfortable, but just a moment of discomfort versus having to pay $30,000 down the road, where you could have just have do your routine
Experience
testing.
or pain depending on the treatment that you receive.
Exactly. Exactly. Because we have ladies who would have missed on their screening, and they find out that they have like the early stages of cancer of the cervix. So, and we do lots of education, because one of the things that we do talk about is postmenopausal bleeding. That meaning that after your period has not showed up, your period a whole year, your period is not there, and let's say you're in the 60s, the age 60s, and all of a sudden, you're seeing that there's bleeding coming when you wipe after urinating. This is something to be concerned about, because we do have cases where there is cancer that has developed even after your menopause. So we need to be mindful of that. So we do lots of education. We really want the ladies, they are showing up because they feel satisfied. They're content with the care that they do receive and the results that they're seeing, and prompt treatment, prompt referral. This is what we're doing now. Mm-hmm.
Yes, I just want you to go back and probably
Mm-hmm.
repeat what you said about menopause, because
Yes.
sometimes you find that people, they think that, okay, maybe I have gone through menopause, but if they notice some bleeding, they say, bagay la vie and lemon. Like they think
Yeah, yeah.
that, the period
Mm-hmm.
probably just came back, that they actually had not gone
Yeah.
through menopause in its entirety. So they
Mm-hmm.
may not
Mm-hmm.
take it as a sign of something being
Mm-hmm. Yeah. So menopause. Okay. So menopause is basically when your period is done. Some people have earlier menopause, but from the time you're possibly about maybe your mid 40s, 50s, your body is basically preparing itself for not making babies, not having to release any more eggs. So when some people, it takes about sometimes 10 years for your body to basically go through the entire process. But menopause is really when you have not seen the period, a consistent period for 1 year. 1 year. That's according to the literature. Some say other, but that's the most one I read most recently. So let's put a little scenario. A 62-year-old female, a 62-year-old lady, it's been 3 years she hasn't seen that period, maybe 5 years. And one day she goes to the washroom, she gone, urinate, and she dries down herself, and she's seen some pinkish reddish blood on the tissue. She should never take it for granted, especially because ladies, you still are sexually active, bleeding after sex. So we need to go to your coming. You can, if you don't have a gynecologist, you can start off by coming to your nurse midwife, and yes, you can still have your pap smear in your 60s. Yes, once you've been up to date with it, with your pap smear, you can still have it. Once you have your cervix still there, your womb is still there, yes, you can still have your pap smear. We've had cases where the ladies, they took it for nothing. The bleeding was there, and when they were referred, it was basically a little late because it had already reached stage 4 cancer, right? Now, on the other side, the other truth to this is it could just mean that the walls of inside the uterus or the womb is just making a little extra because of the hormones, because of hormones. Some ladies, they go for a treatment called DNC, where they have to scrape inside the womb, right? But I am not there to diagnose. I'm just there to share the experiences and the little possibilities of what could be going on. But at the end of the day, if you're a woman who has had you're in your postmenopausal, you haven't seen the period from 1 year, and the period comes back all of a sudden, when it comes back heavy, or you just seem spotting, please do not wait many months later. Go to your gynecologist. If you don't have a gynecologist, come to the health center, speak to a nurse midwife, and then we could refer you. Okay, we'll take it from there. But please do not keep it a secret. Do not stay home and say it'll pass, or drink some bush tea and say ikai 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 dubut koi. No, we have to get treated. Okay.
Yes, I'm very happy you said that
Yeah.
you would not just sit and diagnose, which is very often what we tend to do. You know, as community members, sometimes we sit at home and we
Yeah.
decide that we know exactly what's wrong with us without ever going in to get the situation checked out. Okay, so as you said, you there's a process. There is,
Yeah.
as you have explained, there is a process by which you can
Hmm.
determine if there's any abnormality or any issue with the cervix. So let us not stay at home and diagnose ourselves. Okay, we have a couple of questions
It's true. It's true. Yeah.
from our listeners. One says, is there
Okay.
a process of detecting cervical cancer other than the pap smear?
Is there any other process of detecting cervical cancer? Not to my knowledge. If there is out there, somebody can please share it, because this is the most fundamental screening tools that has been developed years ago, and it has proven to be cost effective. Number one, it has proven to be life saving, and it's a basic tool, because cancer of the cervix may not necessarily be, if you were to do a blood test, a genetic structure, which we don't offer here because it's quite costly, because you can look at the gene, the cancer screen, but it's quite costly. So this screening method is very relatively basic and cost effective for you, and also it gives out the early detection signs. Because like we said, the HPV screening is something that we do for everybody now, for those who come in, because mhm.
And the other question is, we mentioned being sexually active and cervical cancer. Is it the
Mhm.
sperm or the friction to be the cause? So the person is trying to
Mhm.
figure out what is the cause. I think you
Okay.
explained, but maybe you could repeat so that we
Mhm.
get a clearer idea of what the risk
Yeah,
as it relates to sexual activity.
yeah. So that viewer made two suggestions, which is good. The sperm has nothing to do really with cervical cancer. It does not. Actually, sperm is very good if you're pregnant, and you're nearing your date, and because of what they call the prostaglandins in the sperm, it helps soften the cervix. Yes, so I just wanted to inject that little information there. And if you're near your due date, but if not, then
So
yeah,
basically, Ness, you're saying if you're near your due date, it's a good idea to have sex
you
because
can, as long as you're able to tolerate it, and there's other.
it will help with the whole labor process of opening up of
The prostaglandins present in the sperm, yes, it's quite natural and healthy. So yes, and the viewer asked her she asked about
friction.
whether the friction. Hmm. Which is if there is any trauma to any of the cervix. I haven't come. I'm not saying that it's not possible, because whether there's trauma, it's not. It basically, when you think about trauma, and the cells, the thin the layer of protection is coming off, and then your skin or your is exposed. Yes, it increases the risk for you to have HPV basically transferred, just as HIV. So if there's a little bit of a tear during sex, and this person may be a carrier of it, or perhaps you give it to you, it gets transferred. So that's why we're saying the barrier methods, like the condom, the male condoms, the female condoms, they play an important role in helping prevention of the transmission of these certain viruses. Okay.
Okay, thank you, Nurse. So
Yeah.
we were talking about the whole process of the new method.
Mm-hmm.
In the past, one of the complaints that people have had is that it takes so long to get their results back.
Oh.
So, is that the case with this new method? What's the time frame within which the client could expect to get some sort of their result back?
Yeah, apologies for the things of the past, but efficiency, lots of factors affected efficiency. But now the lab collects these results basically the day of, or perhaps even the day after. But we really the day of the when the pap smear, the sample is collected, the lab actually comes down to collect the samples, and basically a week later the results would be available.
That's
So that
wonderful
this
news.
yes. Yeah, so when you do visit the health centers or whichever private health institution, be sure to you'll really receive a call from the midwife that perhaps seen you, or even from me, because there are times when I do review my clients results and I give them a call, and they come actually come in for counseling. But I need to really encourage the ladies, when we do call you, please come, because you see there some persons are saying they never get the results, they never call. Make sure your number is the number that you really use. Do not change your number 2 days later. If you're basically it's if it's just a WhatsApp call you can receive, let the nurse know, nurse, this number is just strictly for WhatsApp, because we're seeing that the results are stacking up, and our clients are not coming in for the additional count, for, like you said, follow-up counseling. You don't have to be scared. We will not discuss really your results over the phone. It's not a practice. But if we say, come in, we'll have your results available, don't be afraid, because it just most likely is just normal negative, nothing to be concerned about. But we want to walk you through and just give that really extra support that we need. So make sure your number is correct. Please answer the phone, and try our best. If you cannot come on a weekday, we'll try our best to perhaps make ourselves available on the weekend, more the Saturday, because we serve to the public on a Saturday as well. Okay, so please, ladies, attend to the calls.
Okay. So
Mhm.
this, I'm glad you touched on that, because that is one
Yeah.
of the questions I had in terms of
Mhm.
what happens when the results become available at the health
Mhm.
facility. The-
Yeah,
You've
that's
already said that the client, whether there is an abnormality or not, the client will receive a call to come in for the results. So you the
definitely.
result over the phone.
Yeah, we asked you to come in, and although some of them are a little persistent, nurse, what happened? It's all right. What happened? Tell me, yeah, tell me. Like I said, well, please come. Just but sometimes you give in and you say, no, everything is okay, but you need to still come. But usually, phone consultation, everybody receives phone calls differently, and we rather do it in person. Okay, and if there is any abnormal results, let's say there's a HPV positive for HPV, then we do have the like I said, the community gynecologist, and then we refer you from there. And if there is any other, like based on the cytology, whether there's any I don't have the document now, but for those who are familiar with your pap smear, if you look to the base of the paper, you will see certain criteria, certain like LSIL. It's basically the different stages of basically of CIN, of cancer, and if there is a persistent infection, then we could refer you to the gynecologist, or you just might see me if I'm able to treat, and then I treat.
Okay. So,
Yeah.
nurse, when a client comes in, the clients are usually, we're usually very anxious. We're a little anxious.
Of course.
So, so when a client comes in and perhaps that client has an abnormality,
Hmm.
how is that usually communicated to the client in order to try to reduce the level of anxiety? Because we can go from 0 to 1,000 very
It's
quickly without
true.
thoughts.
It's true. Let me tell you, let me just share with you, even as a clinician is sometimes a little bit of it's if you know you're heartfelt, and it's hard to even share with this client. I see there's a bad of infection there. If it's a simple infection that can be treated with just antibiotics, it makes your heart a little bit lighter. But I really try my best. So I'm always welcoming, and um, perhaps other clinicians will not smile more than somebody else, but the environment is always basically confidential. Number one, we want to make sure that people, this is privacy and confidential is maintained, and I want to let everybody know that your results are not shared with anyone who is not putting it on the team. Like, obviously, it's me, the clinician. I speak to you, and if there's anything to be referred to, then the physician, the OBGYN, the gynecologist is the one to know, not the clerk, not the health aide, not basically from us to you, and if there's need to be referral to the gynecologist. But in breaking down news that is not too pleasant, there's always a glimmer of hope. You know what? This is that, but however, there's treatment for it, and the test is about taking it step by step approach. Don't think of everything as a whole and think that your life is ended or whatever the case may be, but taking it step by step approach. So I try my best to break down the good news and the not so good news.
So the follow up includes a bit of
Mhm.
counseling and also the
Always.
referral to the
Yeah.
gynecologist, and the
Yeah.
gynecologist would take it from there in terms of the
Hmm.
abnormal results.
Yeah, every client that has any concerning results, we ensure we'll not let you go and leave this office space or the institution and you do not have an appointment for follow-up care. We need to establish that. You're going to leave with a date, you're going to work with that date, and then we're going to walk you through. And if you have any concerns whatsoever, feel free to contact any of us. Whether it's me, I tend to care, and most of the nurses, the midwives, they do the same. You can contact at this number. If you have any concerns, feel free to call and so on. So we really counsel, and we do have our mental health nurse practitioner available. If there's something beyond my area of expertise, then she's there for referral.
Okay. Thank you, Nurse. Thank you so
Yeah.
much. I just have a couple of questions from a viewer,
Okay.
and we're
Okay.
almost at the end of our time. It went by very quickly, as I told you it
It
would.
did. It did.
So,
Hmm.
the viewer is asking, are there any diet practices that you recommend? One, and can you get it genetically? I think you
Yeah.
touched on the last one, but
Yeah. So,
just
genetically speaking, HPV is not inherited genetically. Okay. But however, we do understand that there is family history of whether there's breast cancer, whether your aunt had cancer of the endometriosis. There are various, I'll not go into it at all. Just wanted to highlight these things. But it's important for you to know your family history. Okay. Very important. And so you can really make your lifestyle choices to the best of your ability to basically. And look, we're talking about, you speak about the viewer asked about food, whether based on your diet. Yes, there are certain foods based on there are your, like we said, that you can get, your body can rid itself of the HPVs, certain HPVs, especially within when you're at a younger age, because you're young, everything is basically at optimal level. So your health of your vagina it's at its best. But as we age, we know things decline, especially when it comes to the hormones. Even the structure of the vagina changes. So yes, eat healthy. I know some probiotics are advised. There are certain foods you can eat that help with the natural flora of the vagina, probiotics. And I know what you maybe know commonly known as the yogurt with the what's the it's prebiotics and probiotics. Just read the label and you will see that active cultures. And you're free to go on because there are advocates out there that really speak about vaginal health with the dietary lifestyle. But bear in mind, if you're practicing sexual practices outweigh with the healthy things that you're doing on the other side, it makes no benefit. It comes to nothing. Okay, so if you, and again, we want to encourage person to at least have one steady partner. I know that's not the trend now, but that's what research has proven, not just my personal perspective, but research has proven if one steady partner, it reduces the risk for STDs, HPV exposure, and so on. So I hope this answers the question for the viewer.
Thank you so much, Nurse Deterville. It was wonderful having you on. I think you
You're
did
welcome.
full job of explaining everything as it relates to cervical cancer. I actually wish we had a little bit more time. I'm sure the things we could discuss on
There
the
is so much to talk about. You can't exhaust these conversations. I know.
so I want to thank you for joining us this morning. I'm sure
Yeah.
you took some time out of a very busy schedule. I really appreciate it, and I'm sure the viewers will benefit from the
Hmm.
information that you shared today. I look
Right.
forward to having you on the program at another point in time. You seem to be a natural. Okay. So
You're
thank
welcome.
you
You're
so much.
welcome.
Yes. And
Hmm.
to our viewers, we had a few comments. So to Sheldon Lionel, who is a regular, thank you so much for your input, for your questions. And
Mm.
thank you to Rena Butcher for your comments. We
Oh.
always look forward to the feedback from our listeners, our
Hmm.
viewers, and
Right.
hope that the information that we share will be
Hmm.
beneficial to all. Look
Hmm.
up the dates for your cervical cancer screenings at your wellness centers around the island. Book
Hmm.
that, make the effort to go in and get it done.
It's true. Yeah.
Remember, nurse said we don't have to go every single year.
No,
So
we don't.
this year can be your starting point,
It's true. It's true.
and go in and get it done. It's
Hmm.
very important. Your life could be saved by having your pap smear done. So thank
Yes.
you to everyone again. Thank you to Romanus for helping out with the virtual aspect of it, our tech guy. Without you, it wouldn't be possible. And thank you to the staff of the radio station who allow us and
Hmm.
help us during this program. Thank
Yes.
you, Liz.
And thank you for having me. It was great being here, and I'm happy I could at least share and encourage somebody out there. At least they consider it, they contemplating, and they're moving with what we discussed this morning. So thank you for having me. Hmm.
Have a wonderful day. Bye bye.
Okay, thank you. Bye bye.
And thank you for joining us on Casualty 911. We will meet again next week, Monday, same time, same place.